So nose, very clear she's had done. She's probably had a nice rhinoplasty. It could be it could be a nose implant. It is possible. So I'm not sure about that because this shape can be created with the nose implant or with surgery as well. In fact, we can actually even create this with fillers. So it is very much possible. So we'll see. The next slide is going to be an amazing one. You're going to love that slide. Then you can clearly see the chin. So it's more flat, more pointed. That's a chin filler. Lips, flat lips, upturned lips. So it's actually lip fillers along with Botox. So there's something called lip Botox nowadays. So it's called as a selfie lip or my baby Botox, in which we create an upturning of the lip. So it's a little bit of filler, a little bit of Botox as well. The jawline, but what is more important, she's probably not done much for the jawline here. But you see, she had a very square face, and this is a very sharp face. So this is because of Botox. Personally, I have also done Botox on my jaw. So I have done Botox here myself on my jaws. I've been doing it for 3 years, and I have of course I don't look as pretty as her, but not that bad. I don't look as bad as these two guys as well. So it's somewhere in the middle of between these two. So I've done that here as well. Then, if you see, there's a bit of hollowness here. So this is called as a buccal fat surgery. So we remove some fat from inside the mouth and create this kind of a hollowness here. Then cheek, someone rightly said, so she's had filler, she's not had surgery. Yeah, it is possible. She might have had a cheek implant as well, but more likely that she's had fillers. See, what happens is a lot of these celebrities, they don't go for cheek or chin implants because they need to keep looking different for various occasions. So with a surgery like that, their face kind of gets fixed. So you'll see in the next picture, yeah, she's had chin enhancement, of course. So you'll see in the next picture what I mean, but most likely to be fillers here. Then, of course, breast implants. So someone did mention about Miss Tanya. You mentioned about breast implants. Absolutely correct. So she's also had the tattooing here, micro blading. So the eyebrows are much more dense, and the lift is achieved with either threads or with some micro Botox here as well. So that is achieved. You can see the direction of the eye has changed, and that is because using a little bit of fillers as well as Botox. And so when you inject a lot of Botox, a lot of fillers on the cheeks, the direction of the eyes, the angle of the eye can actually change. And you can even do surgery. So if you also notice, this is a very heavy upper lid and it's a lighter upper lid. So she's probably had surgery here to remove some extra skin from there. So I don't know about the tummy. I'm sure there would have been some other procedures being done, but these are just about 12, a dozen procedures that probably have been done by her. And there is no way she could have turned from here to here without undergoing those kind of procedures. And this is what plastic surgeons can actually achieve. So we also do what is called as an anti-aging thing where we can literally fix your face. So if you're 35 today, for the next 10 years, you will look 35 itself. So that's what we can actually do as well. Tanisha, yeah, okay. So what is Botox? What is filler? Good. So let me try to answer that. Okay. So do you note these lines here on Donald Trump's face? So these lines come on when he's laughing. And do you notice this on Kim? So these eyebrows or these lines come when they are laughing or moving their face. On static, these lines are not there. So what happens is Botox is used for correcting wrinkles which come on when we are animating, when we are talking, when we are smiling. So correction of these lines, so Botox basically weakens muscles. So what happens is this is a very heavy muscle and this creates a square face. So when we inject Botox here, the muscle gets a little weak and the face goes in. So that's what I've done on myself as well. So Botox also corrects the wrinkles here. Botox can lift up the eyebrow by select. So what we do is eyebrow is a very delicate interaction of muscles. There is a muscle which pulls the eyebrow up, and there is a muscle which pulls the eyebrow down. Just 1 second, please. Yeah, and when we take an interplay, so if we weaken the muscle which pulls the eyebrow down, the eyebrow will go up. And we also correct these wrinkles. Fillers are meant for like enhancement. So cheek enhancement, chin enhancement, adding something, and lip enhancement. So that is what fillers. So I hope you understood what is the difference between Botox and fillers. I'm going to just talk about that in another slide as well. Just moving ahead. Yeah. So let's. This is a very interesting one. So I've kind of tried to trace the life journey of this amazingly beautiful girl. So this is how she looked very early on in her life, and this is how she looks now. You see, there's a huge variation also when she started to look very pretty. See the lips here, see the lips here. So they keep changing that. So a very chubby face. Now, if you notice, there's a bit of a difference in the smile. So probably she tried to change her smile. That didn't go too well. So while she's smiling normally here, there's something wrong. Either some teeth correction work or some botox, something is not right. The nose is still the same, not much of a change. As we go here, again, more or less the same. She looks more fair. The lips are a little bigger. So she's started to do, and also you will note that the lip has turned outward. So she's done a bit of Botox on the lips, a little bit of filler, then started to look a little more pretty here. She's probably done, so you can see the depression here. So I was talking about the buccal fat. So यहाँ से उसने fat most probably निकलवाया है. So at this stage she's done buccal fat. Lips are bigger. Notice this picture, she looks so much younger. That is because she's done Botox here on the side of the face here, and the face has just gone in, and she's enhanced her chin. So if you actually see, this is a very nice point. It's a huge difference between this face and this face. Then clearly buccal fat was already done, and the chin has started to come up a little bit. And now Botox, the effect only lasts for 6 months. Therefore, the thinness of the face has started to broaden out again. Then she's done more Botox here. Lip has been significantly enlarged here. Here, the lower lip is much bigger than the upper. Sharper jawline, so she's done something on the jawline. So we enhance the jawlines with fillers. But somehow, these two faces don't look very pretty. She, this particular face is a lot more pretty compared to these two because now she's got a good shape, good normal lip. So there's a ratio. The upper lip to lower lip ratio should be 1.6. So if this is 1 centimeter, this should be 1.6 centimeters. So in this, you see that ratio is not there. Here it's not there, and therefore so here her facial proportions are also a lot better. So one third, one third, one third, and therefore she looks the prettiest in this pic. I'm going to put a small quiz here. Pehchan kaun? Please tell me who do you think this lady is. So please put it in the chat box. So Donald Trump wants to know, India wants to know, America wants to know. Who is this lady? I'm waiting. I'm going to give 20 seconds. Please put in who do you think she is or he. Oh, Disha Patni. Okay. Sakshi, you want to know about tummy tuck and liposuction? Sure, I'll talk about that. Priyanka Chopra. Any other guess? Ankur Shukla, Priyanka Chopra, Priyanka Tanisha. Okay. Anybody else? I thought that was a little more tough. It took me a few seconds to recognize her. Now, can you believe that that same girl who you saw in the previous picture is actually once? Can this girl start to look like this without plastic surgery? I mean, in not in my wildest dreams, can this girl look like this girl without plastic surgery? Look at the nose. Huge difference in the nose. A nose implant as well as a surgery or rhinoplasty itself. See the lips. Huge difference in the lips. See the jawline. See how the lips have turned upwards. This is called as a gummy smile. See, she always used to smile with her gums showing. They no longer show. So this is treated with Botox here. Can we change her to this? Well, I hope not. Can we change him to this? Impossible. So Katrina Kaif, you can see chubby face, round face. Suddenly she looks so much sharper. Sharp jawline, no jawline. And you can see the visible contour of the cheek. Nothing visible here. So if we see between these three pictures, so she's done lip enhancement, clearly visible. Lip enhancement here is very clearly visible. She's of course lost weight, But if you see the nose here and see the nose here, huge difference. And then Botox for the jaws, fillers on the cheeks to enhance the cheeks, and Botox here. Buccal fat, probably not. I can't be 100% sure, but definitely jawline creation. If you see those wonderful jawlines of Deepika and Kareena Kapoor, most plastic surgeons will tell you that that can be created with fillers. So let's go on to what is the science of the face. How do we age? Why do we age? So younger face after 30 years starts to look like this. See the changes. The eyes come down, wrinkles start happening, the laughter lines become heavier, the face starts to droop down, these lines come up, the neck starts to show. So Donald Trump has all these features, a lot of these lines, heavy neck, everything. So this is called jowls. You can see on the lady as well. So a projected image of what she would look. So the eyes, the extra skin on the upper eyes, wrinkles forming, the eyebrow falling down, under eyes developing, the cheeks falling down, lips falling down, the angle, the cant of the angle of the lip is different, laughter lines getting heavy, jowls forming. So this is what happens as we age. What goes wrong? The basic problem is gravity. So gravity, aging don't go well together, and this is what really kills the face. So a lot of people will say we want to mature normally. We have a sexier mind. We are actually old wine. Unfortunately, we need some anti-gravity as well to carry all that. So what we do? So what happens is when we look in the mirror, we keep saying this is not right. Unfortunately, हम लोग मिरर को देखते रहेंगे सारे दिन, तो वो ऑटोमेटिकली कभी चीज ठीक नहीं हो जाती है. Massages on the face never help. Anti-aging products should be used to reduce the damage of sunlight and other things like pollution. Must use them. Sunscreens are necessary. Botox and fillers, if used on the face, actually reduce aging. It has been well proven that if you use Botox on half the face, after 5 years or 10 years, the जहाँ पे फेस पे यूज नहीं किया गया था बोटॉक्स, उसकी एज कहीं ज्यादा होती है. So Botox and fillers actually retard aging. And so when we talk, so this is a patient of a facelift. See, she's actually about 53. So face jowls दिख रहे हैं, more or less flattened face. So what I have done, I've pulled up all the muscles. I have defined the mid part better. I've injected some fat here. See what happens is हम जब age करते हैं, the fat starts to fall down. And when we enhance this part, the face looks much more natural. If you see hollow eyes, I've corrected them by doing something. And this younger version of this lady, you will all agree, starts to look much better. So I'm going to just ask you, a few of you who want to put in on the chat, do you like the left picture or the right picture? Which is more beautiful? Tell me. Just 20 seconds, left or right? Right? We are also circulating the form. So if you want to fill in this form, this comes straight to us and we'll fix up a video consult with me, right? So obviously, perfectly right. So I like that answer, obviously. Why do people then shy away from plastic surgery when they know there can be so much of changes that can be possible? We are literally transforming lives with plastic surgery, with minimum downtime and with the maximum effect, with minimum side effects at all. So guys, the whole purpose is that if you have the means to look a little better, don't shy away, don't be scared of plastic surgery. And plastic surgeons, people like us are very cute, are very nice, and we're very friendly people. So love your plastic surgeon and love plastic surgery. Sunscreens, Botox, and something called vampire facials. Vampire facials are a very new advancement using face PRP and stuff. So that really helps to preserve the age. Then one second. So I wanted to actually play this small video. I won't do that right now. It is that something about facelift is a very technical point, so I'll skip this. But injection of fat on the face is one of the most beautiful ways of preserving age. And Dr. Patrick Tournard, who's my teacher, one of the senior most plastic surgeons in the world, he's from Belgium. So I had done an interview with him a few weeks back. and we were talking of how facelift works and what is the role of fat. And in this particular video, he talks about how fat can really rejuvenate the face. Some people start to worry about breast implants. They keep saying, I don't think it is safe. I don't think you can breastfeed. Young girls should not do it. Older people should not do it. Middle aged people should not do it. In fact, no one should do it. Plastic surgeons should never do it. So, why breast implants are absolutely safe? There are various types of implants available. I always recommend the use of approved implants. So there is a brand called Motiva that is the world's best implant today, and there's a brand from France which is called Seba. It's written as Sebin, Sebin, but it is pronounced as Seba. And so Seba and Motiva are the world's best brands today. And why are they the best? Because they give you a lifetime warranty. Anything goes wrong with implants, the companies replace them free of cost. The next slide, they are widely tested for more than 40 years. Patient can breastfeed. Breast implants do not increase the incidence of cancer. They are safe in most, in fact, all age groups. Branded implants do not cause any allergic reaction. I can't say the same for Chinese and Korean implants. And one message I always like to give on my channel is please do not mess up with these things. Please do not save some money. Please do not get into the trap of doing cheap breast implants, because how can you do a cheap implant is by buying a cheap implant. And I have shown some videos, and in fact a Chinese implant can burst just by pressing, and I'm going to show that a good implant doesn't leak, perforate or damage. So just watch this wonderful video. I hope you get the sound. Guys, did you get the message I'm trying to give in this fun video? Just put it in the chat box quickly, 20 seconds. Just put it. What I wanted to project is that these are safe, these are sturdy, they don't perforate, they don't break, they don't puncture, as long as you have the best quality implant done. An average breast implant surgery only takes about 30-35 minutes. Oh, I'm so sorry. Yeah, thanks, Gaurav. I like that. That see, the whole idea is in my entire education, which I give to a lot of people on my YouTube channel everywhere. The idea is that the message needs to go across, that it's about safety. And I also tell everyone what you should not be doing. So I'm so sorry, Preeti, you could not hear it. Just fill in the form. I'll send you the video. It's a beautifully short video. I'm sure you will love it. So if there was someone else who did not get it, please fill the form. And Pankaj, I'm so sorry. I'm sure someone did hear it, but we will send you the video link if you want to. I'll see if I can post the link of this video in the chat itself in a little while, so you can see it directly from YouTube. I'm going to go down now. Then we talk of liposuction. Someone wanted to understand about liposuction. Liposuction is for body contouring. It is not for weight loss. Why? आप जब खाते हैं या एक्सरसाइज कम करते हैं तो पेट में फैट इकट्ठा हो जाता है. मैंने लाइपोसक्शन करी, मैंने फैट निकाल दिया, तो आपकी शेप आ गई. लेकिन अगर आप अपने लाइफस्टाइल को बदलेंगे नहीं, फैट एक्यूमुलेट होता रहेगा, तो हाउ विल इट दैट बेनिफिट, दैट फैट इज गोइंग टू कम बैक. Therefore, it is meant for people who want better shape, and it is not meant for weight loss. Someone asked me about liposuction and tummy tuck. So I'm going to send you a link of a video I have on YouTube. In fact, if you type on YouTube tummy tuck, Dr. Amit Gupta, then you will get a few videos where I've explained the differences between lipo and tummy tuck. Briefly, tummy tuck तब किया जाता है जब स्किन लूज हो पोस्ट प्रेगनेंसी या वेट लॉस के बाद, लोअर एब्डोमेन में जब स्किन लूज हो जाती है, उसमें टमी टक किया जाता है टू कट आउट दैट एक्स्ट्रा स्किन, एंड लाइपोसक्शन इज डन फॉर फैट रिमूवल. बहुत सिंपल डिफरेंस है, बट देयर आर लॉट मोर अदर डिफरेंसेस. So please check out my video on YouTube. I'll try to post that link here as well. So, so liposuction is not meant for this chubby guy. जो आइसक्रीम्स अगर सारे दिन खाते रहेंगे तो आई एम सॉरी, आपकी ढोलकी ही बनेगी and not that six pack appearance. So what happens in obese people, the fat is actually inside the organs, intestine, liver, etc. And इस वजह से हम लोग पेट के अंदर से फैट नहीं निकालते हैं, हम लोग स्किन से फैट निकालते हैं. That is why liposuction is not meant for obesity. Botox and fillers, what age? Earlier it was believed 35 to 40 years से start होना चाहिए, but today even people in 20s are asking for it, particularly like for lips, for uh, changing the shape of the nose and the correcting small wrinkles around. There's something called as a baby Botox lift. There's a lot of things which, in fact, there's one condition can be done even younger. कुछ लोगों के आर्म्स में, एक्सिलास में, palms में स्वेटिंग होती है बहुत ज्यादा, so we can inject botox and reduce the sweating. In fact, समर से पहले अगर अंडर आर्म्स को आपको स्वेटिंग कम करानी है, so we can do botox there and reduce the sweating in everyone as well. So, so I've tried to show some of the benefits of Botox for sweaty palms, underarms, then lip enhancement, smile corrections, masseters. So मैंने खुद ही so this is, I'm sorry, this word just came out. So this is for masseters. I clearly see the difference on the face. I've done for myself also. तो यहाँ पे हम लोग डालते हैं बोटॉक्स को, इंजेक्ट करते हैं. Takes a few seconds and you can change the shape like that. Then you know her, most of you know her. See the difference in the face. So we do what is called as baby botox all over the face to smoothen out and tighten the entire face. So mummy makeover surgeries, mummy makeover means that you've had pregnancy and you want to get back to a more petite, more sexy kind of a figure. So we enhance the breast. We can put implants. We can do breast lift. Breast को उठा भी देते हैं. We do liposuction. We do tummy tuck. Extra loose skin को सबको cut कर देते हैं. Belly button को better shape देते हैं. And we also work on the vagina. We do vagina tightening, and we do what is called as a designer vagina as well. So coming on to the intimate areas, this is a favorite area of mine, and because we're getting a lot of patients coming for this, and you can actually seriously change the sex life of people. Now, can ladies rejuvenate their sex life? Of course. So there's something called O shot, which enhances the orgasms. You can get orgasms much faster, so you don't need to fake orgasms anymore. You can actually get that on your own. And then you got G shot. There are a lot of people who go for hymen surgery, vagina tightening. There's labia minora. So some women have extra skin hanging out of their vagina. So we do that. So quick spectrum. There are some women who go for clitoris piercing as well. G spot enhancement. So this is what I was talking of in terms of the labiaplasty. Then the O shot procedures. So that's what all we can do. Something for the men. Why should women have all the fun? Can men make their own male organ more powerful? Can they make it longer? Yes. We can actually increase the length by about an inch, sometimes even more, and we can increase the width by uh, by injecting fat and even injecting fillers into the organ, and you can actually increase the width. So I've done it for an American patient who came in I think about 2 months back. We increased the width, the circumference by about 1.2 centimeters, 12 millimeters, guys, and that is what keeps Sunny Leone interested. So if this is what you dream of, then you need something here as well. So can you make dolas with surgeries? Of course, I'm just going to quickly, should I show this video? This basically is a video which shows, so I'll quickly, it's a 37-second video. So just bear with me on that. So you can see the arm is, so I'm going to be starting the arm. There is no definition right now. I'm going to remove the fat and I'm going to create an outline. Just see. So you can clearly see the outline that has been created. As the patient recovers after 3 weeks, you can clearly see a beautifully defined deltoid can be created. We also create an outline on the top. So this becomes like a dola, and we can actually inject some fat here and really create that kind of an athletic look. So this video was basically defining six packs. I'm not going to show that in the interest of time. So we are getting a little late. Then gynecomastia, one of I think today at Divine, today we are doing the largest number of gynecomastia surgeries in India at least. An average month, we're doing over 65 gynecomastia surgeries, and we've kind of become like a research center as well. We are innovating a new classification that is really helping all our patients. In fact, we are even going to be starting training of doctors on some of the newer methodologies in gynecomastia. So we can create a lot. You can see this huge chest. Just 1 second. So this one second. So a large chest, normal, hanging chest, normal, large chest, normal. And this guy had like a huge chest. Uh, this pop-up keeps coming, but see the breast is going
4
right.
बजने में 10 मिनट.
प्लीज आप म्यूट कर लीजिए. सारी ऑडियंस को सुनाई दे रहा है कि आपको 10 मिनट में कहीं जाना है. रियली अप्रिशिएट अगर आप म्यूट कर लें. सो आप देखें कितना बड़ा ब्रेस्ट, ऑलमोस्ट लाइक अ फीमेल ब्रेस्ट, and we have been able to create this in one stage itself. So this is the kind of magic we are doing with gynecomastia. Then about hair transplant, like I said, one of my favorite procedures, and you can see a whole range of hair transplant patients and literally magic being created in terms of the results. So we've changed a lot of lives with hair transplant. A lot of marriages have happened. A lot of job promotions have happened with hair transplant, and that is why I rate hair transplant as one of the most moment-defining, life-defining surgeries amongst all plastic surgeries. So, guys, this is what I wanted to discuss in terms of the spectrum, and I'm going to get back now, and let's just, so if we have some questions, anything that somebody wants to know. Otherwise, we've also, so there's a form which has been circulated. Just fill that. It'll take you hardly 15 seconds to fill that form, and then my team will fix up a one-to-one consult. Today is Sunday, so we'll do that tomorrow, and we'll fix up a one-to-one consult. And we're also going to be starting a new thing. We're going to have appointments with me. The patient can decide when they want an appointment online. So we're going to be doing something very interesting with that. We're going to be creating a calendar where it will be sent to you, and you can choose some slots which according to your convenience. And we are going to roll this out permanently even after the lockdown. तो होता क्या है, कई बार हम हमारी क्लिनिक के एंड से, कोई भी क्लिनिक से प्रेशर आता है आपके ऊपर, सर इस टाइम पे आ जाइए. नाउ यू सिटिंग इन योर हाउस will know what time Dr. Amit is available, and you can block your slot sitting in your house, and we will get that message. So we're going to be creating that also very soon. And I'm just going to quickly go over some few questions. If there's something you would like to ask me live, just raise your hand. To raise your hand, it is very simple. आप manage participants में जाएंगे नीचे सबसे. So you will find the list of the participants, and वहाँ पे raise hand का एक icon होगा. So just press that, or you can even switch on your videos, and you can just raise your hand and just indicate if there's something you'd ask me. If you're not comfortable asking on a public forum, I understand that completely as well. Preeti, I'll just come to you. So might be someone. So just you can send it. You can send a message to us via the form as well. Or we've also, we've created a WhatsApp group. So we're going to be using that WhatsApp group for spreading information. In addition, we have groups on gynecomastia and hair transplant. The whole idea is we want to spread information to you. We're going to be having a gynecomastia webinar on Tuesday and a hair transplant webinar on Thursday. So all of you who found some benefit from what I've been talking to you today, please tell your friends and family to attend. If they're suffering from hair fall, hair loss, women, men, anything, just ask them to join and just drop us a message, and we'll get you to register. There's somebody who's suffering from gynecomastia, please join in with me on Tuesday, and I'm going to make that really informative as well. So this is the form which has just been sent on the group. Please take that form. If you just ask for your email and whatever you would like to know, it's in complete confidence. So you don't have to bother about your confidentiality leaking out. So that is something we really promise. I'm just going on to the chat once. Just answer a few questions which are here. I'm going to start from the top. Okay, so someone has asked about once. Great. How can we choose the size of breast implant? So there's a video I've put up. So if you go onto YouTube, there is a video how to select size of breast implant from a Dr. Amit Gupta. But I'm going to just broadly tell you, just give me a second. I'm going to bring in a breast implant and I'm going to show you right here how we define the size. Just give me a second. Okay. So what we do is, so as you can see, this is a breast implant. Just now in this breast implant, so it has a dimension. So it has a dimension from here to here and from here to here. This implant is to be centered on the breast. So if this is a patient, you can see the nipple projection in the center. So this implant has to be placed right in the center. So what we do is we measure the breast size. So we would be measuring from here till here and from here till here. And then depending on how much large a breast a woman wants, there are various projections which are available. And so I'll just spend. So what it means is, this is an implant. There can be a flatter implant and there can be a larger implant of the same size. So there are some people. So for example, I once had a patient who wanted breasts like Sunny Leone, which means really big implants. Then I get people who are housewives, they say, we want normal looking breasts. So then the profile is different. So that is how we select. Of course, I know this is very brief. I can give you more details. You can see that video. It's a 7-minute video on YouTube, and I'll send you the link. So just fill out that form and I'll send that link as well. Otherwise, you could just go onto YouTube and just Google selection of breast implants from a Dr. Amit Gupta, and you'll find it's a beautiful video where I've explained each and every intricacy of how you measure breast implant. What's the best brand? I just mentioned Motiva and Seba are the best available worldwide. Motiva is today. So this implant which I'm holding in my hand is a Motiva. It's really soft. So if you press this implant, it's like it feels so natural. In fact, the brand is also called as Silk Surface. It's really as smooth. Cost of surgery varies. So at our, so I'm going to send you. So once you fill in that form, I'm going to send you the cost of the surgery as well, so you are in a better position. Which operation? Just okay, so normally I prefer to do it from the just under the breast because that is the most direct approach, has least complications. There are people who also we also do it from the underarms. The problem with underarms is we can't put very large implants. Secondly, the rate of asymmetry, so mismatch, is the highest from the underarm area. Also, from the underarm area, another problem which sometimes happens is the scar can be visible and you can't wear sleeveless clothes. Around the areola area, so there's another approach from the areola. I don't do that. It's not a great approach. There's some thought of getting infections. The rate of infections is slightly higher from that, so we don't talk of that. Preeti, can fat be injected? Of course, fat is regularly injected onto the face. We can do lip enhancement, chin, cheeks, under eyes, or even we do it in the superficial areas of the skin to create a glow, to create like a nice glow to the face. The face just looks much younger, and we do that as well. In fact, even we do it for uh, acne scars, like I showed you. So that is routinely done. Just going down to the next one. One second. So just answered that. Is there any scar after surgery? With surgery, Ankur, I'm not sure. We generally try to hide the scars so they don't get really visible. Do tell me with surgery so I can tell you better about that. Yeah, Tanisha, I think I've answered your question. Preeti, okay. Gray hair, sadly, unfortunately, not yet, but you can prevent it a little bit perhaps by high iron diet. So they said that low iron in the food causes graying of the hair. Next, treatment for eye bags. Yes, eye bags we can do with surgery or with even with fillers. So we inject fillers here under the eyes and they get better. And we even do surgery to remove the extra bag. Thank you for reminding me. I think I forgot to mention that. And in my next webinar, I promise I'll put that. I'll put some pictures of blepharoplasty. Tina, please take a note of that and make sure I do that. And so we do blepharoplasties from they can be done from outside as well as inside the eyes, and they cause a radical change. I'm going to show you some pictures, and they cause an amazing change in how the face looks like. Do you have the pictures of that blepharoplasty patient? If you can do screen sharing, uh,
So that upper and lower
upper
eyelid.
and lower,
I
या
have a
फिर वो
picture
even
of,
that lawyer जिनका
yeah,
lower
I
हुआ था,
have his picture. I can share with you
just
on
try if you
WhatsApp.
can.
I'll just
and,
send you.
and even that lawyer जिनका वो lower eyelid subconjunctival हमने किया था,
Yeah, I think I
so
have
just
his
see if you
picture.
have that. We'll just find that. And once again, next, can basal liposuction avoid? Yes, it can. Definitely. Very good question. Sorry, I don't know your name. Yes, it can. Not in everyone, but to a certain extent, it definitely can. Can burn marks be removed through surgery? Unfortunately, not. Unfortunately, scars cannot be removed. They can be improved a lot with fat injection. There's been a lot of study on use of fat in burn scars, and there has been very good results with that. So I personally like to combine fat along with the PRP. So we actually like to do that. I'm sorry, मेरे बाल थोड़े लंबे हो गए हैं because of this lockdown. Not able to cut my hair. Gets a little difficult to manage. So uh, then, yeah, thank you for posting that video for Tanisha. Tanisha, you can watch that video. That will be great. Thank you so much for posting that. My team is really wonderful. So just post anything and you get everything from us. In fact, we're going to be more, we're going to be making our systems more automatic in the coming months. And it's you as a patient will really feel delighted to be associated with us, not only because of the treatment, the various treatments we offer, the kind of treatments, but the whole experience of being attached to a center, something all automatic, sitting at home, getting everything done, a very responsive automated unit. I promise you're going to be getting that within a few months. So that is going to be amazing.
Sir, I have shared that picture with you on
Uh,
WhatsApp क्योंकि यहाँ नहीं हो रहा screen
आपके
share.
में screen sharing नहीं आ रही?
नहीं, आप
Let me see if I okay. So I'll screen share my WhatsApp with you, and I'll show you that blepharoplasty picture. Just one second. Just give me a second. Let me do that right now. Gynecomastia, yes, it is virtually invisible. You can hardly see the scar. So just give me a second. I'm going to screen share the blepharoplasty pic. It's a very, very nice result. One second. Just a few seconds, please. Just connecting my laptop to my phone for the WhatsApp. Just yeah. Okay. So this is the so as you can see. So you see these heavy eye bags here. Young male, lot of appears to be a lot of extra skin, heavy eye bag. I did his surgery from, as you can see. I don't know if you can actually see. This is the scar I had given just under the eyelash. You can hardly see it, and it goes here like this. And we have more or less corrected his fat bag. We have tightened the skin also a lot, and a remarkable difference in his appearance. So that is what a blepharoplasty can do. Thank you, Tina, for sharing that. . Then I'm just going to go back to the questions. Gynecomastia scar, I said. What about breast implant surgery, Mark? So, yeah, we can improve the breast implant surgery, Mark, with we can do a scar revision. We can do silicone gel pads there. That tends to improve. We can do steroid injections. That also tends to improve it a lot. From Preeti, yes, eye bag surgery is permanent. So once we've done eye bag surgery, it is permanent. So I think Preeti had raised her hand, Anu had raised her hand, and you've asked your question. So if there's anything else you'd like to ask me as well, just raise your hand. It will be easy so you can ask me live. It becomes a little easier. Anu, I'm just going to unmute. Anu, yeah, Anu, would you like to ask what you wanted to? Anu, are you there? I've unmuted you. I think she is not able to hear me. No problem. So does anyone else have any question? So please go ahead and ask me. And so we're going to wrap this up in a minute or so. And I'm going to invite you for the gynecomastia webinar. Anyone in your family, friends, that's Tuesday, 2 o'clock. And a hair transplant, so all about hair loss, men, women. We're going to talk of a lot of aspects. I'm going to make it very question answer based. That's on Thursday. Anu, yes, sir. My biggest fear is scars. So, Anu, if a scar is holding you back, don't worry. We promise that we'll be able to give you the finest of scars and you can barely even see it. See, I'm going to I'm going to send you a testimonial. 1 second, if I can just bring it down immediately. Just see how the life changes after a breast implant surgery. So there are two videos I have on YouTube. So two of my patients have gone live with me on YouTube, where they've spoken about how their life is completely transformed after a breast implant surgery. And you need to hear those experiences to really know what it is. Something like a scar should not hold you back because what you get out of an implant surgery is something immense. It is beautiful. And so just let me see if I can actually get that. While I'm answering any question that comes up, let me just quickly see if I can download that particular video. So I'll post the link of that video as well. Anything? So that's the last question, I think. Great. I think I've been able to. Okay, so I've got that video. Just give me a second. I'm going to just copy the link and just listen to this beautiful interaction I had with a celebrity fitness person. So she, once, I'm going to just copy the link. I'm going to put it on the group so you can actually see it from there. So yeah, that's the second one is the link. So just see that, and you can actually trust me on this because see we are nearly doing about 8 to 10 such surgeries every month, and the biggest thing which people always come back and say how their relationships have improved, how their confidence has come up, how they've started to do much better at office, personally with their partners, uh, job. It's amazing. It's just amazing to listen to all those stories. So don't let the scar hold you back. So guys, thank you so much for connecting with me here. And if there's anything, do let me know. And if there's anything that my team can do to improve, do let me know. And if you're on the WhatsApp group already, please post some feedbacks. We want to improve. I want to make this a monthly event, even after the lockdown, even after the virus goes away, because life doesn't stop. And I want to get more and more people to benefit from what I know from the knowledge. So any pain, hardly एक या दो दिन के बाद अंकुर जी, there's hardly any pain. People get back to their office 7 7 दिन बाद तो exercising शुरू कर देते हैं. So that's it. So thank you. Have a wonderful rest of the Sunday and be safe, guys. Please, this coronavirus is not going away very fast. So please be safe. Please maintain social distancing. It's important. Your being at home is saving a lot of lives. So each one of you is a warrior amongst yourself as well. So please stay there and just give yourself a few more weeks, and I think things will start to get very normal. Thank you, Gaurav. Really, really appreciate. So, guys, we also make a lot of effort, not during, I mean, for surgery as well. It takes, so I'm 45. It's taken me 18 years of studies to become a plastic surgeon, and it takes a lot of effort to do what we do, as well as to create something like this. So, I really appreciate the small thank yous and appreciative notes that come from your side. So that really bucks me up for creating something better. And do also let me know how what all things we can add, because we're going to be getting more people in. So there may be things which I might have missed out. So do let me know what I can add and so make it more informative. The idea is to give you the knowledge which I have and maybe help you transform your life in a way. So guys, I'm going to be signing off right now. Thank you so much for being here, and I really loved all the questions you were putting up, and I would really love some feedback. Do let your friends and Gaurav, what you can do is just note. I'm going to. How would you like to? So just fill in that form. What we'll do is we'll fix up a one-to-one on Zoom for hair transplant discussion with me, and you can actually do that. You can actually even so that once you send it that form, my team will get back to you on that. And you've already seen some of the results which can happen. So really great magic is created. Wonderful. So just fill in that form which is there on the chat window, and we'll make sure that we take care of. You can also join in the group. I'm going to just pass on the hair transplant webinar group detail. Oh, sorry. So it doesn't matter. You can fill in the form, and I'll send you all the details from there. Thank you so much, guys. Thank you for being with me today.